Welcome to Labcast, a podcast about the medical laboratory science profession, brought to you by MedLab Convo. To get notified once we drop an episode, you can do well to subscribe to all our social media platforms at MedLab Convo. For questions, feedbacks, and shout-outs, you can do well to send a mail to at medlabconvolabcast@gmail.com. Thank you for listening.
Hello, everyone. Welcome back to your most favorite episode or your most favorite podcast in the whole of Nigeria, the Labcast podcast. So today we're talking about something that quietly runs the backbone of many laboratories, the Laboratory Information Management System, or as some people call it, the LIMS. If you've ever dealt with lost samples, delayed results, manual errors, or the stress that comes with high volume days, this episode is definitely for you. LIMS has become the most important digital tool, or one of the most important digital tools in the lab. And if you understand how it works, it can completely change your game. So we have with us a wonderful and respectable person that is going to be helping us to dissect the issue of LIMS, the one and only Scientist Gana Samuel Gana. So please, can you say hi to the audience?
Hello everyone, thanks for having me here.
Yes. So he's a man of few words. Let me just tell you all about him. Scientist Gana Samuel Gana is a master's student and an assistant lecturer at Newgate College of Health Technology, Mina, Niger State. I'm sure this is not the first time that you're hearing of him in our podcast, and that's because he has so many things to offer to us. So we're going to our first question or discussion for today. A lot of people have probably heard LIMS because they've heard of medical records. But can you just help us buttress what LIMS is and what exactly it does for a hospital lab on a normal day?
All right, thank you once again for having me, Iheoma. I don't take this for granted. All right, so Laboratory Information Management System, or LIMS as we call it, um, is a software that help us as scientists manage samples and everything that's associated with samples, from sample collection, the analysis that is done on the sample, the results that are obtained, then what happens in the end, all the downstream applications that we do to the sample until it gets to the patient or the clinician. This is what LMIS looks for. This is what it automates. And it started from just simple record keeping, where in the olden days we write on paper, well, got tired, and we have to think of better ways of keeping these things. Although one of the major reasons of paper recording was that anything could happen to it. And so making things electronic was just a good approach. And from there, down to see different things or different applications we could do with it. And this involved, excuse me, sorry, this involved the two-way communication between machines and the system, which helps us optimize our results, which helps us reduce many errors that are associated with lab. So, laboratory information management system is a system that helps us to optimize everything that has to do with a patient sample. Thank you.
All right, thank you so much for that. I would like to ask, how do you think that LIMS practically improves sample tracking and reduces mix-up, especially during periods where the sample volume in the laboratory is a lot?
So, when we are looking at LIMS, LIMS has to do with four key areas. There are basically four functions. And the first of all is sample management. Now, no matter how many samples come into the lab, no matter the workflow that comes into the lab, each of these samples is given a unique number. For example, let's use paper lab. So when I used to work in paper lab, we usually collect samples from different local governments, different states, that's KB and Zamfara and Sokoto. And so we usually get at least up to 1,000 sample, more than 1,000 samples certainly. And we enter the samples. And so each sample is given a unique number, and that number is barcoded. Now, because each sample represents a patient that is barcoded, what it means is that whatever we are doing with the sample, the identity of that sample stays in such a way that wherever the sample goes, whatever application we do to the sample, let's assume, let's say, where we, at the paper lab, sorry, we usually run HIV viral load, early infant diagnosis for children that were born from HIV parents or mothers. So we don't make mistakes because, again, each sample is barcoded and the machine knows what it's supposed to do, such that when you look at one of the functions of LMIS, there is a bidirectional instrument interface in which it works. So what it means is that the LMIS is a server, right? A software program that interfaces with the machines. So still with the example of HIV viral load, HIV testing that we're doing. So when we go into the system, we load into the sample into the system. It gives us a unique barcode for each patient. And so when we carry the samples to go and run them, each patient has its unique barcode with unique numbers. And these are the things that we do to ensure that we don't make mistakes. Thank you.
The next question that I want to ask, you have already shed a little bit of light on that, but I will still ask. A lot of people are so used to manual record keeping that they don't know that LIMS is integrated with analyzers and equipment, and because of that, it helps to reduce manual errors. So I want you to throw a little bit more light on that in the very practical sense.
Thank you for that question. So when you look at the LIMS interface, there is a particular feature that is called bidirectional interface. Now, what this bidirectional interface does is that it allows the LMI system to integrate with machine in such a way that whatever you are writing to the LMIs, whatever you are putting into the LMIs, the machine understands, or let me put it in this way, sorry. It's like a conversation, yes, between the LMIS and the machine. Let's take, for example, an hematoanalyzer, right? An hematoanalyzer would, is a machine that basically does blood work, runs hematology testing on blood. So you have that machine and you have different samples. Now, using the LIMS, sorry, what you do is that you enter each of the patient's details into the system. Now, what it does is that because you have entered their data into the system, each particular sample is given a unique number or a unique code. Now, because each sample is given a unique code, then there is a barcode scanner that scans each of the samples. Now, once it scans the sample, it automatically brings out the details of the patient, right? And once it brings out details of the patient, it also knows the particular test to run. Now, this is in turn is a communication between the machine and the system. So, in such ways, if four people are coming for different blood analysis, it's going to do different analysis for each of the patients without making mistake. That's one. So secondly, this is in a series of process. First of all, there is a command that the LMIS give the machine, and the command acts as a query or a worklist such that the data that the system will send to the machine includes the sample ID, the test required. Now, what the analyzer will do is to give feedback. Now, the feedback that it's going to give is in form of the result of the patient. So, in fact, this is better explained using chemistry analyzers, where you run different tests on different samples. So, the one that is in my head now, is it 6 mex? Yes, I think it's 6 mex. So, it's able to run different blood analysis, chemistry analysis on different samples. And so you have one person doing EUCR, you have another person doing LFT, you have another person doing glucose test, you have another person running lipid profile, and you are entering this into one machine to do all. Now, what it does is that because you have used LIMS, you find out that the LIMS will tell the machine what to do without you stressing yourself to enter anything into the machine. And when it does that, once the machine is done running the sample, it will transfer the result back to the LIMS, in which prevents you from making any mistakes, maybe from entering results. So that's that.
Thank you very much. You were really detailed on that. And I hope that our listeners will be able to visualize it and hopefully see it in whatever facility that they work in or will work in. So this leads me to my next question, which I'll be asking. What common challenges do labs face when switching from paper-based systems to LIMS, and how do you think that they can overcome them? Because let me say something. I remember when I was doing my internship, and the HOD of a particular specialty kept on insisting how that manual ways of doing things would forever remain the gold standard. And a lot of we of interns they were just looking at, why is this woman trying to be a cake? A lot of older people have that belief that the manual system is the best and the automated system just makes things. I mean, if you use the automated system, you will not know what you are doing again. So, how can we overcome these challenges of switching from paper-based system to LIMS?
Okay. So even the older scientists, there were methods that when they were younger scientists, they saw was also archaic, and they brought the requested for change. And the truth is that the times that we live in now, change is happening at a fast rate. In fact, sometimes if you don't follow the trend, you will actually lose. So there was a time where we had to do everything manual. But now automation is here. And the funny thing is automation is here to stay. So one of the major problems that scientists have in transitioning, number one is resistance. In fact, the truth is that nobody likes change, but then change has to happen. So resistance is one major problem. Number two, people don't want to upgrade. What do I mean? Now, one thing that comes with using LIMS is that you have to be a computer literate. At least you should know how to type, you should know how to use a computer. Most people are not willing to learn that. This is in simplest form. I remember when I was doing my internship then, there was a particular department that started doing electronic um, data reporting, electronic result reporting. And so you find out that most of the heads in the lab, they will not be, they will call interns or they will call students to come and enter results for them. And so throughout my time there, I helped enter results for them. And when you ask them, okay, how is this done? They'll be like, oh, figure it out. In fact, you'll be surprised that some of the older scientists don't want to know how the chemistry, the semi-auto-chemistry analyzer work because that resistance is there, and number two, they don't want to grow. So, secondly, again, moving data from paper to the system requires a lot of effort. Yes, that's another. So this is supposed to be third week. That's another major challenge that people have. Again, some believe that with doing this, there could be challenges. Okay, what if the data is hacked? What if, how am I sure that the data we are putting in safe? What safety measures are being put in place for the data that we are entering? So there are a lot of concerns. But what I would like to say is that first of all, we must understand that change is constant, and one thing that makes us professionals is our ability to adapt to change. In fact, what would help us more is our ability to actually be proactive when it comes to changing. How we lead the change. So this is one thing I believe that we can do. Then again, it's not too late for anybody to learn how to become technology savvy. That's what I believe. And I also believe that one thing with this data is that we should just start. And when we start, at some point we finish entering all our data LIMS, and the benefits are enormous. Some also believe that LIMS is going to take away their jobs. One thing I know is that once there's a disruption in the market, one major thing that happens is that new opportunities come out. Thank you.
Yeah, thank you. You just took the words right out of my mouth because I was going to ask that don't you think that scientists will then be threatened by this? Is this scientists now? Yeah, but the whole system will be threatened by this. But like you said, once this kind of things occur, there are new opportunities in the market because this one can start up a totally new line of business. I mean, but yeah, thank you so much for addressing that. Well, let me ask, right? Because as in as much as we're trying to educate people, we're also trying to proffer solutions. So for laboratories with limited budgets, what do you think are the most essential LIMS features they should prioritize when choosing a system? What do you think that there's a lot to do in LIMS and there's a lot of things attached to it, but things, little things that would help them in their own record keeping. What do you think that they can prioritize?
Um, all right, thank you for that question. So, of course, we all start small, but I think one major thing that LIMS should, or one major thing that small labs should start with is to use the cheaper LIMS versions. For example, there are different LIMS versions that are available, and depending on the one that your budget takes. Let's depending on what budget you are on. Now, the most expensive is the on-premise LMIS, and in this one, the software is installed into the facility, and the servers are located within the facility. So, the scientists and their computer engineers are the ones that are managing everything that is associated with the lab, and that is pretty expensive. But however, there is maximum control of everything that happens to your data. Now, the second one, I am going to this out because I want to say something. The second one is cloud based. Now, the cloud based one is hosted by a vendor. And now, what this vendor does is that the vendor has a server, but you as a facility, you are connected to the vendor, and that is cheap. And the third one, of course, is open source. Open source is the one that most people use. In fact, the licensing fee is very low and it's very cheap. So, as a scientist wants to start, or as the facility wants to begin using LIMS and looking at cost, I feel that they can use a cloud-based LIMS. Now, a cloud-based LIMS has lower initial cost. And as your lab begins to upgrade, as your lab begins to increase, then you can begin to add other things. Now, there are some important things that every lab will need, and this serve as the foundation for what a lab stands for. For example, every sample needs to have a sample handling system, which LIMS can provide. One. Number two, every now when we talk about sample management system, we are looking at what happens to the sample from collection down to release of results, down to storage of results, down to anything that can happen later on. Okay, you did this test on the 24th of whatever year, and we need you to bring out the sample. All facilities should be able to have that, and this is one major thing that LIMS can give. Secondly, because again, we understand that human beings are prone to error, it is also good that laboratories that are starting small should also be able to integrate their machines if they are running automation. They should be able to integrate their machines on the LIMS. But if they are running manual, of course, they would have to type it in manually. But if they are running automation, it saves sample error, entry error, whatever kind of error that we think about. So I believe that these foundational things are what every lab should prioritize: sample handling and automation interface where they communicate. So these are the things that I believe that with LIMS, a basic lab can start with that. Thank you.
All right. Thank you so much, sir, for that insightful reply. So we'll be moving into our this or that segment. So manual sample logging or automated LIMS logging.
My dear, for someone who have seen what automation can do, I think automated sample logging.
Okay. Paper results or digital result release.
Digital results, please. You can misplace paper, and it happens a lot.
Barcode labels or handwritten labels.
Barcode labels, please.
Okay.
When we are labeling samples, especially one major problem we have is how we write. Some people like write their three like as five, some write their five as three. So this is one problem that most of us have. But if it's barcode, of course, everyone has a unique barcode. So please,
Yes, that's true. So let me ask the last question. Lab trained IT support or external support only?
lab trained IT support. See, yes. Remember I said whenever there is a change, whenever there is a disruption in market, opportunities open. Now, one major opportunity that has opened because of LIMS is that we have scientists who can go into software design, who can go into software maintenance. And so, because we have scientists that are in these various fields, they understand what is going on when a system is having issues. And if they are able to say with their medical laboratory science experience, be able to say, okay, this machine is having fault and this is what is going on. For example, one major thing that LIMS does, especially in the advanced ones, is that it's able to look at to run QC, quality control, on the results that are being generated and is able to flag a result that goes out of control. And so, because of that, it opens an opportunity for those people who have medical laboratory science training and also IT training to be able to help know whenever the system is having overload or the system is becoming faulty. So, forever, external support may not understand the science behind some things that are going on. So, again, an MLS, please.
All right. Thank you. Thank you so much, Scientist Sam. This brings us to the end of today's conversation. And if there's one thing to take away, it's that the digital systems are definitely not replacing the scientists. They're empowering us to work faster, smarter, and with fewer errors. So, whether you're already using an LIMS system or your lab is still considering the switch, understanding the basics put you ahead. Thank you for listening and being a part of this community. Kindly follow us across all social media platforms at MedLab Convo. And if you have any contribution, suggestion, or questions, please don't forget to forward it to medlabconvolabcast@gmail.com. Till next time, bye.